Across this country and around the world this evening, people are asking themselves the same question about where we've got to in our fight against COVID, and that is, does the progress towards a vaccine that's been announced today mean that we are at the beginning of the end of our troubles? So let me set out our assessment. The Pfizer-BioNTech vaccine has been tested on over 40,000 volunteers, and interim results suggest it is proving 90% effective at protecting people against the virus. But we haven't yet seen the full safety data, and these findings also need to be peer reviewed. So we've cleared one significant hurdle, but there are several more to go before we know the vaccine can be used. What I can say is that if and when this vaccine is approved, we in this country will be ready to start using it. Earlier this year, the UK government ordered 40 million doses of the Pfizer vaccine, enough for about a third of the population, since you need 2 doses each. And that puts us towards the front of the international pack on a per capita basis. And I should add that we've ordered over 300 million doses from 5 other vaccine candidates as well. If the Pfizer vaccine passes all the rigorous safety checks and is proved to be effective, then we will begin a UK-wide NHS-led programme of vaccine distribution. We will decide the order in which people are offered the vaccination, taking account of recommendations from a group of scientific experts, the Joint Committee on Vaccination and Immunisation. And they're looking at a range of factors, including the different characteristics of different types of vaccines, to work out the most effective way to protect as many people as possible and save as many lives as we can. And we'll be setting out more detail about that in due course. But, and you know I'm going to say this, I must stress that these are very, very early days. We've talked for a long time, or I have, about the distant bugle of the scientific cavalry coming over the brow of the hill. I can tell you that tonight that toot of that bugle is louder, but it's still some way off. We absolutely cannot rely on this news as a solution, and the biggest mistake we could make now would be to slacken our resolve at a critical moment, because on Friday, Sage reported that the R is above 1 in England, though that doesn't take account of the current national restrictions. Alas, the death figures are rising, running at an average of 300 a day, sadly double where they were 24 days ago. The number of COVID patients in hospital has risen to from just over 10,000 2 weeks ago to nearly 13,000 on the 5th of November, and we're heading towards the levels of the previous peak. Irrespective of whether there is a vaccine on the way or not, we must continue to do everything possible right now to bring the R down.